Welcome to Quest for Well-Being. In this video, we examine the impact of chemotherapy on the body. Join us as we embark on this insightful journey. Chemotherapy, often referred to as chemo, is a cornerstone in the treatment of cancer, involving the administration of potent drugs to eradicate cancerous cells. While chemotherapy can be highly effective in targeting cancer, its impact extends beyond tumor cells, affecting various parts of the body. Understanding the mechanisms and effects of chemotherapy is crucial for patients and caregivers alike to navigate its challenges and optimize treatment outcomes. This video explores the multifaceted effects of chemotherapy on the body, delving into both its therapeutic benefits and associated side effects. Chemotherapy involves administering various medications to combat cancer by destroying cancerous cells. Although there are numerous chemotherapy drugs available, they function similarly by halting the reproduction of cancer cells, thereby impeding their growth and dissemination within the body. Although chemotherapy medications have the potency to eradicate fast-growing cancer cells, they also have the potential to damage healthy cells, leading to various adverse reactions. The severity of these reactions depends on your overall health, the stage of your cancer, and the type and amount of chemotherapy you receive. Several side effects may resolve soon after the treatment concludes, while others could persist for extended periods, ranging from months to years, or possibly endure indefinitely. It's crucial to communicate any side effects that you encounter with your doctor. Depending on your body's responses, your doctor may need to modify the chemotherapy type or dosage. Chemotherapy may be administered in cases where cancer has metastasized or when there's a potential for it to do so. It can be used to try to cure the cancer completely. Chemotherapy may make other treatments more effective. For example, it can be combined with radiotherapy or used before surgery. Chemotherapy reduces the risk of the cancer coming back after radiotherapy or surgery, and relieves symptoms if a cure is not possible. Here are the different types of chemotherapy. Chemotherapy administration methods vary, and your medical team will advise on the most suitable option for your treatment. The most common types are chemotherapy given into a vein, which is usually done in hospital and involves medicine being given through a tube in a vein in your hand, arm, or chest, and chemotherapy tablets, which usually involves taking a course of medicine at home with regular checkups in hospital. You may be treated with one type of chemotherapy medicine or a combination of different types. Typically, you'll undergo multiple treatment sessions, usually spanning several months. How does chemotherapy cause side effects? Well, chemotherapy affects healthy body tissues where the cells are constantly growing and dividing, such as your hair, which is always growing, your bone marrow, which is constantly producing blood cells, and your skin and the lining of your digestive system, which are constantly renewing themselves. The damage to these cells can cause side effects. However, normal cells can replace or repair the healthy cells that are damaged by chemotherapy, so the damage to healthy cells doesn't usually last. Certain chemotherapy medications have the potential to harm cells in various vital organs such as the heart, kidneys, bladder, lungs, and nervous system. To mitigate these risks, patients may be prescribed additional medications alongside chemotherapy to safeguard their healthy cells. Additionally, there are available treatments designed to alleviate any accompanying side effects. How long do side effects last? Many side effects may dissipate promptly, while others could persist for several months or even years before fully resolving. These are referred to as late effects. Occasionally, the repercussions endure indefinitely, as seen with chemotherapy inducing enduring harm to vital organs like the heart, lungs, kidneys, or reproductive system. Specific chemotherapy variants can also trigger delayed consequences like the emergence of secondary cancers years down the line. Predicting the exact side effects one might experience proves to be challenging. Individuals frequently experience feelings of discouragement regarding the duration of their treatment or the adverse effects they encounter. If you find yourself in this situation, it's important to communicate with your cancer care team. They can explore options to adjust your medication or treatment regimen and offer strategies to alleviate any pain or discomfort you may be experiencing. Here's a list of several typical side effects. However, experiencing all of them is improbable. Tiredness. Tiredness or fatigue is one of the most common side effects of chemotherapy. Many people having treatment feel tired a lot of the time or get tired very easily doing everyday tasks. Feeling sick and being sick. Many people having chemotherapy will have periods where they feel sick or are sick. Your care team can give you anti-sickness medicine to reduce or prevent this. Tell your care team if your medicine does not help or it causes too many side effects. There may be a different one that works better for you. Hair loss. Hair loss is a common side effect of chemotherapy, although it does not happen to everyone. Ask your care team if it's likely to be a side effect of the medicines you're taking. If you do lose hair, it usually starts within a few weeks of your first treatment session. If you lose lots of hair, this typically happens within 1 to 2 months. It's most common to lose hair from your head, but you can also lose it from other parts of your body, including your arms, legs, and face. The hair loss is almost always temporary. Your hair should start to grow back soon after your treatment has finished. But sometimes the hair that grows back is a slightly different color, or it may be curlier or straighter than it used to be. Hair loss can be upsetting. Talk to your care team if you're finding it difficult to cope with losing your hair. They understand how distressing it can be and can support you and discuss your options with you. For example, you may decide you want to wear a wig. Synthetic wigs are available free of charge on the NHS for some people, but you'll usually have to pay for a wig made from real hair. Other options include headwear, such as a headscarf. Preventing hair loss. It may be possible to reduce the chances of hair loss by wearing a cold cap while you're having chemotherapy. A cold cap looks like a bicycle helmet and is designed to cool your scalp during a treatment session. This reduces blood flow to your scalp, reducing the amount of medicine that reaches it. Whether you can use a cold cap depends on the type of cancer you have. Cold caps also work better with certain types of chemotherapy medicine, and they do not always work. Ask your care team whether a cold cap might help you. Infections. Chemotherapy can reduce your body's ability to fight infection. This makes you more likely to get infections that could make you seriously ill. A course of antibiotics may sometimes be prescribed to reduce your risk of getting an infection. Anemia. Chemotherapy lowers your amount of red blood cells, which carry oxygen around the body. If your red blood cell count drops too low, you'll develop anemia. Symptoms of anemia include tiredness and lack of energy. This tends to be more severe than the general fatigue associated with chemotherapy, shortness of breath, noticeable heartbeats, and a pale complexion. Including a high amount of iron in your diet can help reduce your risk of anemia, as iron helps the body make red blood cells. Foods high in iron include meat, such as beef, pork, and lamb, beans and nuts, dried fruit, such as dried apricots, whole grains, such as brown rice, fortified breakfast cereals, and dark green leafy vegetables, such as watercress and curly kale. Bruising and bleeding. Chemotherapy can reduce the number of cells called platelets in your blood. These help stop severe bleeding when you cut or injure yourself. If you have a low number of platelets, you may have skin that bruises easily, severe nosebleeds, and bleeding gums. Tell your care team if you experience these problems. You may need treatment to increase the number of platelets in your blood. Sore mouth. Sometimes chemotherapy can make the lining of the mouth sore and irritated. This is known as mucositis. Symptoms tend to develop a few days after treatment starts and include the inside of your mouth feeling sore, as if you've burned it by eating very hot food, mouth ulcers which can become infected, discomfort when eating, drinking, and/or talking, a dry mouth, reduced sense of taste, and bad breath. Loss of appetite. You may lose your appetite while you're having chemotherapy, but you should try to drink plenty of fluids and eat what you can. Skin and nail changes. Some chemotherapy medicines can cause temporary changes to your skin. For example, it may become dry, slightly discolored, more sensitive to sunlight, red and sore, and itchy. Discuss any skin issues you encounter with your healthcare professionals. They can provide guidance on suitable creams for treatment and offer recommendations for sun protection measures. Talk to your care team if you have any problems with your skin. They can advise you about creams that can help and how to protect your skin from the sun. Chemotherapy can lead to the brittleness or flakiness of your nails, possibly causing the development of white lines on them. However, these nail issues typically resolve once your treatment is completed. Memory and concentration problems. During chemotherapy, individuals may experience difficulties with their short-term memory, ability to concentrate, and attention span. Simple tasks may require significantly more time to complete than usual. The reasons behind this phenomenon remain ambiguous. However, typically the symptoms improve following the completion of treatment. Sleep problems. Some people having chemotherapy have difficulty falling asleep, or wake up in the middle of the night and cannot get back to sleep. This is known as insomnia. Insomnia, identified as the inability to fall asleep or stay asleep during the night, is a common challenge for individuals undergoing chemotherapy. It frequently results in disrupted sleep patterns such as difficulty initiating sleep or waking up in the middle of the night and struggling to return to sleep. Sex and fertility issues. A common experience for individuals undergoing chemotherapy is a decrease in sexual interest. Fortunately, this decline is typically temporary, and once treatment concludes, one's libido usually returns gradually. Certain chemotherapy medications may diminish fertility in both males and females, with effects ranging from temporary to potentially irreversible in certain instances. Before commencing treatment, it's advisable to consult your care team regarding potential impacts on your fertility. If there's a chance of infertility, they'll guide you through available options. Women have the option to freeze their eggs for future use in vitro fertilization, while men can freeze their sperm samples for potential use in artificial insemination at a later time. It's advisable to refrain from getting pregnant or causing pregnancy while undergoing treatment, as chemotherapy drugs may pose risks to the unborn baby. Employing a barrier form of contraception, like condoms, is recommended in this situation. Diarrhea and constipation. Following the commencement of chemotherapy, it's possible to experience either diarrhea or constipation within a few days. Your healthcare professionals are equipped to suggest appropriate medications and dietary adjustments to alleviate these symptoms. Undergoing chemotherapy often entails frustration, stress, and trauma, leading to natural feelings of anxiety and uncertainty regarding the treatment's effectiveness. Experiencing heightened levels of stress and anxiety may elevate the likelihood of developing depression. Speak to your care team if you're struggling to cope emotionally. They can offer support and discuss possible treatment strategies. Joining a cancer support group may also help. Talking to other people in a similar situation can often reduce feelings of isolation and stress. While side effects can be unpleasant, they must be weighed against the need to kill the cancer cells. Despite these challenges, ongoing research aims to improve the effectiveness of chemotherapy while minimizing its adverse effects, ultimately enhancing the quality of life for cancer patients undergoing treatment. Did you find this quest insightful? Well, if the answer is yes, please let us know by commenting in the comment section below, and please remember to like, share and subscribe to our channel for more insightful videos. Cheers to an enriched life. Thank you for watching.